Public Health Ambassadors Uganda is proud to have organized the third Public Health Youth Symposium, which is a gathering of academicians, research experts, and even organizations that are very much involved in health promotion and even general sexual and reproductive health. The theme for this year was opportunities and challenges of achieving universal health coverage in regards to young people's sexual and reproductive health.
Universal health coverage to me means health for all. It means quality, affordable health services. By health services, I mean preventative treatment services for all people, of all populations, of all gender, race, that's non-discriminative. We at Global Health Corps believe in health equity, and our goal is to build a movement of health leaders to achieve health equity.
These services should be of quality, there should be financial protection, so there should be no discrimination depending on race, religion, sexuality or geographical location. So the same service as me, someone living in town, receives should be the same service or the quality as somebody in a rural area.
The kind of UHC I would want to see in Uganda today is the kind where youth are can freely express their views on sexuality and their needs for sexual orientation.
How we can improve UHC is if we can try and include people with disabilities in our programs. It's easy for us to benefit these services.
Universal health inclusion would mean me accessing the health services freely without me spending a lot, because if I'm to go for a health center, I have to pay for myself, I have to pay for my interpreter, I have to pay for their transport. But it would be better for me to reach the health facility without having to carry an interpreter whom I'm going to pay if someone already knows the language of how to communicate with me.
Uganda as a country will be able to reach the UHC goal when at least it improves the accessibility of the healthcare facilities to everyone.
It can be achieved if every one of us commits to contributing. Instead of spending precious time blaming everybody else, I think everyone should ask themselves, what have I contributed to achieving universal health coverage?
By empowering young, passionate leaders, equipping them with leadership skills, and bringing their technical expertise to high-impact organizations and helping to build the systems of those organizations and increase the reach and impact of those organizations.
So as public health ambassadors, we've managed to come up with a communique that we're going to present to the members of parliament. And this communique is also going to be taken further in the various, countrywide, in the various districts, to various district health personnel, of which it will be used as a basis to assess how well these districts can further achieve their universal health coverage.
But also to government and policymakers to keep up with the funding. They should keep on supporting us funding and prioritizing health sector, as well as funding the policies that were put in place to implement them, to track progress, as well as to evaluate at the end of the implementation to see the impact. With that, we shall be able to achieve universal health coverage in Uganda.